19 million new sexually transmitted infections occur each year, almost half among 15 to 24-year-olds. Many think using contraceptives, such as condoms, would stop the uprise of STDs, but the Catholic Church says otherwise. Contraception is wrong because it's a deliberate violation of the design God built into the human race, often referred to as natural law. The natural law purpose of sex is procreation. The pleasure that sexual intercourse provides is an additional blessing from God, intended to offer the possibility of new life while strengthening the bond of intimacy, respect, and love between husband and wife. The loving environment with this bond creates is the perfect setting for nurturing children. Today we're going to look into the lives of two people stricken with STDs, what they would have done differently, and what their beliefs are as Catholics.
Please, Ronald, can you give us a more in-depth look into your story?
Well, I guess it all sort of started during college. You know, I was wild. I really didn't think about any sort of consequences. And, you know, toward the end of college, I, settled down. And then soon after, I graduated college. And, the time after college was difficult. I started noticing some things, burning during urination, the itchiness, the redness. Then I decided that, it was too severe to ignore. So I went to a doctor. He ran some tests. Then he called me the next day, and he diagnosed me with gonorrhea.
I see.
Ronald Berger now has decided to follow in a Catholic life and is very active in his community, trying to stop the spread of STDs. He believes all teenagers should practice abstinence because it is 100% effective in preventing STDs.
So doctor, I just found out I have HIV. What are the chances of my baby being born with HIV?
Well, you see, when a woman is infected with the HIV virus, there's a very high possibility of the baby also becoming infected through natural birth. Luckily, through a cesarean section, it lowers the possibility a great amount.
How did your doctor visit go?
Not so good. He told me that my baby will most likely be born with HIV.
How's your family going to take it?
I don't know. They're really religious, and they're not going to be happy at all.
They're going to be really mad at you?
They're going to be really mad. They're based on the church's teachings and everything, contraception, which I didn't use, and they're just going to be really angry.
Globally, about 1,000 HIV-positive children are born each day. In many developing nations, contracting HIV from one mother is a death sentence. 50% of children who get the disease from their mothers die before their second birthday. Without drug treatment, an HIV-positive pregnant woman has a 1 in 3 chance of infecting her child during pregnancy, labor, and delivery, or through breastfeeding. We went around to local establishments and asked their views on STDs and contraceptives. And this is what they had to say.
Do you think they're good or bad?
Yes.
They're good.
They're good?
That's a hard one. It's also a good one.
Yeah.
Because you don't want to go against the church, but it starts really in the house. Safe-sex contraception. So it's what the parents tell the kids in the house. Now, if they're just running around and never say anything, then your kids go haywire and no talk is given, and then they go to church and they repent. But I don't think for the church to, I wouldn't be against it. I wouldn't be against it. Because inside of congregations there's parents and grandparents. Same thing like home. So.
And I think that abstinence is difficult to answer because everybody's a different person, but it depends on your relationship, I guess. So that's how I think about it. So I can't really say that.
Yeah. Why? Because too many problems arise from quick and easy sex, unwanted children, you know, you get yourself in a situation where you think you need to stay with somebody you shouldn't have been with in the first place.
Do I believe in abstinence? I don't know. Everyone has like their different feelings about that kind of stuff, so that's a hard question to answer. I think that using contraceptives did not really help your moral conscience because it's just using an excuse. They would definitely stop STDs. Well, I don't know about stop them all the way, but they would help prevent them.
In today's society, people living with HIV and AIDS are prone to discrimination, prejudice, negative attitudes, abuse, and maltreatment from other people. They are being shunned by family, peers, and their community. This can cause psychological damage and negative effect on the success of HIV testing and treatment. Although the church rarely condones these actions, they do believe that each person deserves respect and should be treated the exact same way as they were if they didn't have HIV or AIDS. After being diagnosed with HIV, a person may ask why. For answers, some turn to their family. Others talk to doctors or mental health professionals. Sadly, some will turn to drugs or alcohol. But for many people, support mainly comes from religion and spirituality. How does HIV, religion, and spirituality intersect? Can religion and spirituality help in dealing with an HIV diagnosis? So ask yourself this question: how does religion and spirituality help? HIV is a medical condition treated by medicines. However, that statement is only half true. Very early on, it became clear that HIV was much more than a physical ailment. It affects the entire person, physical and emotional. And for many, the way to treat an emotional issue is through religion and spirituality. A diagnosis of HIV causes fear of the illness itself, fear that there will be suffering, and fear of what the future holds. The fear of illness and prognosis prompts questions. Spirituality and religion often hold the answers to those questions. Answers give the person a better understanding of their illness and themselves. Simply, for those with spirituality, fear promotes healing and emotional calm. Because religion and spirituality can have such a profound impact on one's life, prevention experts are trying to engage religious leaders and religious institutions in the fight to prevent HIV infection. There are times when many people believe religious doctrine and spiritual teachings can create barriers to HIV prevention. The most significant example of this is the debate between abstinence only and safer sex education. Differing opinions between those that support abstinence only teaching and those supporting safer sex education grind prevention efforts to a halt in many communities and even on a federal government scale. But for now, though, the church community continues to pray for those infected, and the medical community continues to search for a cure. We can only hope in the future that one day a solution will be found and those who have been infected will be cured.